All right. Hi, everyone. So I'm Celia. I'm a chiropractor. And thank you so much for having me today to talk, Marge. I loved hearing all of your responses. It's amazing to hear how active everyone is, especially Mary Jane. She stole my line because my line was motion is lotion. And basically, if we are moving and we're keeping our bodies, in good shape, it definitely does help with everyday activity to improve quality of life, to make sure that we're, able-bodied and strong. But walking definitely is one of my favorite types of exercise. It also is really good because it helps to harmonize the central nervous system. So it helps to calm everything down. And it also helps with decreasing cortisol, which is our stress hormone. So if anyone needs any start to exercise, which I know in this group we're pretty good, but if anyone needs to start, just tell them to go for a walk because that'll be a good starting point. So a little bit more about me. From a very early age, in the email Marja alluded to, that I was always fascinated with the human body. I always picked up an anatomy textbook. My dad's also in the health profession, so I would always be asking him questions, and I knew right from the get-go that I wanted to be in this field. I ended up studying kinesiology at York University. And while I was studying there, I took a really special interest in neuroscience and learning about our nervous system and literally everything that it does for us, because it is, no pun intended, it's our head system, it does everything. And I was very interested so much, I was actually looking into doing a master's of neuroscience, but I just couldn't see myself sitting behind a desk and looking through a microscope and just analyzing it in that kind of a perspective. So I wanted to do something more hands-on. So after I graduated and did my 5 years of undergrad, I didn't really know what I wanted to do. And thanks to my mother, she kind of pointed me into the direction of chiropractic. And at first I was a little resilient because I didn't want to do another 4 years of school, and it's a very intense program, but I'm really happy that I did it because the outcome is amazing and I love what I do. So I don't necessarily say that I chose chiropractic. I feel like chiropractic chose me. And the reason why, this is basically our scope of practice. And what we are is we're basically the spine doctors, and we're assessing the nervous system and the joints. And we're seeing any kind of disorder or dysfunction that happens at these levels, and then using adjustments or mobilizations or any other tool that we've learned over the years into helping those symptoms and getting people into an area of feeling better. So it literally means done by hand. So that's why I like it, because I'm interacting with my patients not only on a social level, but I'm getting to touch them. And just like Peter said about the mind, body, and that spiritual aspect, I do believe there's definitely an energy exchange that goes into the chiropractic adjustment. And it just makes people feel so good and so energetic after the fact that they've come into the office. Even if we're not doing a full adjustment, it's just so energizing and getting people going. So we do say that we are the spine doctors. We're also the movement doctors. And I also like to say that we're the nervous system functional and optimization doctors. So I'm going to show just a little bit of like an anatomy demo, because have any of you gone to a chiropractor before or know anything about chiropractic at all? Yeah, I see Peter's hand up. Okay. I guess we'll talk after, but I would like to hear everyone's experience about going to the chiropractor. But this is I guess, the spiel that I give a lot of my patients, because I'm really into educating and to giving people the information about how their body works and how it functions. So I always tell my patients, this is you, this is your skeleton. And basically, when we're doing an adjustment or when we're, bringing back motion to the body, we're basically helping we're initiating that through the adjustment. But the reason why there needs to be that in the first place is because at the level of the joint, I'm just going to zoom in here. At the level of the joint, basically where the bones are connecting one on top of the other, this green little space here, there's inflammation at that area. And it basically is preventing the joint from moving properly. It's not that the bone is out of place or that anything is, misaligned. It's just that it's not moving the way that it should. And that inflammation is the culprit for that. So by providing the adjustment to the body, it helps with the mobilization of that joint so that you can move better and feel better. And the reason I say move better is because not only does the joint move, but if we turn on the muscular system, and start looking at all of these muscles and how they're attaching. Every single muscle in our body is attached to a bone. So if that joint isn't moving properly, then that then that muscle is not moving properly, and vice versa. So it's difficult to say what came first. Did the muscle get injured and that caused the joint to be faulty, or did the joint get faulty and cause the muscle to move improperly? All we know is that when we do the adjustment through a series of evidence and science, it does help to provide more mobility to the area. Now, everyone thinks that you have to be in pain to go see a chiropractor, and that's not true. And this is the reason why, is because not only does it affect our muscles, but it also does affect our nervous system. Like I said, it is the main system of our body, and it's traveling from the skull and the brain all the way down our spine. And then we have these nerves here that exit, and they basically allow for communication in the body. Now, when we have a restriction in the body, basically, like I said before, there's that inflammation there. And what it does is it actually causes a narrowing of this opening, right where this big yellow chunk of nerve is. It'll cause for that hole to become smaller, and that can affect the communication in the body. And when that happens, basically, there's a miscommunication between that brain body connection. And just like on a radio, when there's static, it's not clear. So we end up with something called end organ problems. And that's when we start to get that pain onset and that change and that compensation in how we're moving. So, yes, the biomechanics and the muscles and the joints and all that, that's definitely important in an adjustment, but it also helps to make sure your nervous system is working and functioning optimally. So that's my little anatomy spiel for all of you. So I'm going to go back to here. Okay, so now going back to myself, I consider myself a professional patient because for the past 28 years, I have been to many different doctors. I had a lot of health issues growing up, specifically GI related or digestion related. And they were always telling me, it's all in your head, it's all in your head. And yeah, sure, it is in my head because I'm feeling it, I'm experiencing it. And these are things that I want to get resolved. And I actually never went to a chiropractor growing up. The first time I ever went to a chiro was actually when I was in school, and I got adjusted by one of the interns there. And as soon as I got adjusted, I was like, wow, this is amazing. I'm in the exact profession that I know I want to be in. And I just felt so good. To say that it cured my digestive issues, I don't want to say that, but it definitely did help with the stressors that were contributing to my digestive issues. Because stress is not just like an emotional state that we're in, it's also the physical and the chemical. So definitely did help in relieving the stress in my body that was affecting my nervous system and how everything was functioning. So I did so many different tests, visited countless doctors, but really me taking charge of my health, getting adjusted, that definitely was a big contributing factor to me getting better and feeling better. So for every patient that walks into the office, my goal is to make sure that they're receiving the best level of care. I want them all to feel like they're listened to because I know what it's like to be kind of neglected and shoved to the side. So making sure people are understood with their health concerns, again, understanding their body and how it's supposed to work. And even if I only see a patient once, I just want them to take at least a little bit away and know more about how they're functioning as a human and how to make themselves feel better. It's because everyone just deserves to move and feel their best. So that being said, the reason I picked today to do my presentation is because on October 16th, it is World Spine Day. And it's a great day to get out. Hopefully this year we'll have some good weather so everyone can go on their walks and be outdoors and be active. But it's World Spine Day, and it's basically recognition in regards to taking care of your body, making sure you're moving, using your body in different ways, and just feeling great. And that's pretty much my presentation for today, just short and sweet. And I kind of wanted to keep it open more for questions and getting people to have more of a discussional aspect.